With greetings, I am Dr. Motamedi, orthodontist from Temple University, Philadelphia, Pennsylvania, graduated in 1980. And previously I talked to you about congenital enamel hyperplasia of first molars or sixes and its complications. Now, according to the request of Dr. Ferris Nazeri, endodontist in the United States, I'm again talking to you about second molars. There is no congenital enamel hyperplasia of second molars. I haven't seen so far. Now, if sevens just received caries, and this caries reaches to the pulp, it needs a root canal therapy. But if endodontist decide that this tooth is hopeless, and for any reason you decide to extract seven tooth or second molar, you should consider some points. First of all, when you extract one tooth, the opposite one will over-erupt. So before doing extraction, you should send patient to the orthodontist to stabilize 7 to the 6 with rigid wire from buccal and lingual, not to let it to over-erupt. And after extraction, keep this rigid fixation of 6 to 7 until 8 fully substitute for 7s. This will usually happen even at the age of 15 or 16. If you extract 7s, 8s almost completely will be substituted to the 7s instead of 7s. I'm not going to encourage you to extract 7s very soon. If it's just endodontic therapy and it has thick walls, I mean that the cavity is short and it's not going to break, having break in soon future, just do a root canal therapy. And anyway, if you decide to extract, you should first check the wisdom tooth to exist, to see the wisdom tooth bud and have a normal bud. I mean, from mesiodistally, as far as mesiodistal width of the tooth is concerned, it should be a normal tooth, because several times 8s are congenital missing or abnormal tooth as far as size is concerned. So only when the endodontist says that the 7th tooth is hopeless, first of all, stabilize the antagonist tooth and then observe the wisdom tooth bud and be sure that it is a normal tooth, then extract the 7th. Otherwise, just do a root canal therapy. And if these tooths have thick walls, doesn't need crown even. Now, I told you about the wisdom tooth will be substituted for 7s if 8s are not erupted already. But if the 8 or wisdom tooth are erupted and you extract the 7, just wisdom tooth will tip mesially and doesn't substitute and needs a very tough fixed orthodontic treatment and lengthy treatment also, which is very difficult. So be careful and try to keep and preserve 7s as far as you can. Thank you again, and thanks from Dr. Ferris Nazeri, who asked me to tell you these points. Thanks again.